Question 1. Analysis of a scenario where a 75-year-old patient with locally advanced rectal cancer, who is fully capacitous, has been presented with a treatment plan involving neoadjuvant chemoradiotherapy followed by surgery. The patient, after careful consideration and discussion, expresses a clear and consistent desire to decline all active treatment, stating a preference for palliative care and to spend their remaining time at home with family. Clinical oncology team believes that the proposed treatment offers a significant chance of cure or long-term remission, and that declining it will likely lead to a poorer prognosis and reduced quality of life in the short to medium term. What is the most appropriate course of action for the clinical oncology team? Option A. Respect the patient's decision to decline active treatment and focus on providing comprehensive palliative care, ensuring their comfort and dignity. Option B. Initiate surgical consultation for the patient without further discussion, assuming that the surgical team can persuade the patient to accept treatment. Option C. Proceed with the neoadjuvant chemoradiotherapy as planned, explaining to the patient that it is medically necessary and that their wishes cannot be accommodated in this instance. Option D. Inform the patient that their decision is medically unsound and strongly advise them to reconsider, withholding further discussion on palliative care until they agree to treatment. The correct answer is A. Respect the patient's decision to decline active treatment and focus on providing comprehensive palliative care, ensuring their comfort and dignity. Explanation. This scenario presents a significant ethical challenge due to the conflict between a patient's stated wishes and the clinician's professional judgment regarding the best course of treatment. The core of the dilemma lies in balancing patient autonomy with the duty of beneficence and non-maleficence, all within the framework of UK clinical oncology practice and the RCR's ethical guidelines. The correct approach prioritizes the patient's right to self-determination, even when their decision may seem contrary to their best interests from a medical perspective. This aligns with the fundamental principle of informed consent, which requires that patients have the capacity to make decisions about their own health care, and that these decisions are respected, provided they are made voluntarily and with adequate information. The RCR, like all medical bodies in the UK, operates under the principle that competent adults have the right to refuse treatment, even if that refusal may lead to harm or death. This is underpinned by legal frameworks such as the Mental Capacity Act 2005, which presumes capacity unless proven otherwise. An incorrect approach would involve overriding the patient's wishes based solely on the clinician's belief that a different treatment is superior. This would constitute a failure to respect patient autonomy and could be seen as paternalistic, undermining the doctor-patient relationship and potentially leading to a breach of trust. Legally and ethically, such an action could be challenged as a battery or a failure to obtain valid consent for the alternative treatment. Another incorrect approach would be to proceed with a treatment the patient has explicitly refused, even if it is believed to be life-saving. This directly violates the principle of bodily integrity and the patient's right to refuse medical intervention. The ethical and legal ramifications of such an action are severe, potentially leading to disciplinary action and legal proceedings. The professional decision-making process in such situations requires a systematic approach. Firstly, the clinician must ensure the patient has the capacity to make the decision in question. This involves assessing their understanding of the condition, the proposed treatments, the alternatives, and the likely consequences of each, including the consequences of no treatment. If capacity is present, the clinician must then engage in a thorough discussion, ensuring all options and their implications are clearly communicated. The focus should be on understanding the patient's values, beliefs, and priorities that inform their decision. If the patient's decision remains unchanged after this process, and they are deemed to have capacity, their wishes must be respected. If there are concerns about capacity, or if the situation involves a minor or a patient lacking capacity, the legal and ethical frameworks for those specific circumstances must be followed, which may involve seeking a second opinion or involving the courts. Question 2. The efficiency study reveals a novel chemotherapy regimen demonstrates a statistically significant improvement in progression-free survival for a specific advanced malignancy. However, the study also reports a higher incidence of grade 3-4 neutropenia and a novel, albeit rare, cardiac toxicity not previously associated with standard treatments. In the context of UK clinical practice, what is the most appropriate next step for a clinical oncologist considering this regimen for eligible patients? Option A. Undertake a comprehensive review of the study's methodology, the nature and manageability of the reported toxicities, and consult current NICE guidelines and MHRA approvals before considering its use, alongside detailed informed consent. Option B. Immediately discontinue consideration of the new regimen due to the presence of novel cardiac toxicity, irrespective of its rarity or potential efficacy. Option C. Initiate the new regimen for all eligible patients, assuming the efficacy benefit outweighs the reported toxicities, and document the risks in the patient's notes. Option D. Proceed with prescribing the new regimen for patients who have exhausted all standard treatment options, without further independent evaluation of the study data or specific toxicity management protocols. The correct answer is C. Initiate the new regimen for all eligible patients, assuming the efficacy benefit outweighs the reported toxicities, and document the risks in the patient's notes. Explanation. Scenario analysis. This scenario presents a common challenge in clinical oncology, where a new systemic therapy shows promising efficacy in early trials, but has a potentially significant and poorly understood toxicity profile. The professional challenge lies in balancing the potential benefit of a novel treatment against the risk of harm to patients, particularly when the evidence base is still developing. Clinicians must navigate the ethical imperative to offer potentially life-saving treatments while upholding the principle of do no harm and ensuring informed consent. The regulatory framework for drug approval and use in the UK, governed by bodies like the MHRA and NICE, dictates the evidence required for widespread adoption and reimbursement, adding a layer of complexity to decision-making. Correct approach analysis. The correct approach involves a rigorous, evidence-based assessment of the new therapy's risk-benefit profile within the context of established clinical guidelines and regulatory approvals. This includes scrutinizing the quality and completeness of the efficacy study data, considering the specific patient population studied, and evaluating the severity and manageability of the reported toxicities. Adherence to the NICE guidelines for technology appraisal and the MHRA requirements for drug licensing ensures that any proposed use aligns with national standards for patient safety and clinical effectiveness. Furthermore, ensuring comprehensive informed consent, detailing both potential benefits and known/unknown risks, is paramount. This approach upholds the principles of beneficence, non-maleficence, and patient autonomy, all underpinned by regulatory compliance. Incorrect approaches analysis. One incorrect approach would be to immediately adopt the new therapy for all eligible patients based solely on the reported efficacy data, without a thorough independent review of the study's methodology, the robustness of the efficacy claims, or a comprehensive understanding of the toxicity profile and its management. This fails to adhere to the precautionary principle and the requirement for robust evidence mandated by regulatory bodies like NICE, potentially exposing patients to unacceptable risks. Another incorrect approach would be to dismiss the new therapy entirely due to the presence of any toxicity, regardless of its severity, manageability, or the magnitude of the potential efficacy benefit. This demonstrates a lack of nuanced risk-benefit assessment and may deny patients access to a treatment that, for carefully selected individuals, could offer significant advantages over existing options. It also disregards the iterative nature of clinical evidence development. A third incorrect approach would be to administer the therapy without ensuring that patients fully understand the potential risks and benefits, including the uncertainties associated with a new treatment. This constitutes a failure in the informed consent process, a fundamental ethical and regulatory requirement, undermining patient autonomy and potentially leading to dissatisfaction and harm. Professional reasoning. Professionals should adopt a systematic decision-making process that prioritizes patient safety and evidence-based practice. This involves 1. Critically appraising the available evidence, including the efficacy study, considering its design, statistical power, and generalizability. 2. Consulting relevant national guidelines and regulatory approvals, e.g., NICE MHRA. 3. Conducting a thorough risk-benefit assessment tailored to individual patient characteristics and disease context. 4. Engaging in comprehensive shared decision-making with patients, ensuring they are fully informed about all aspects of the proposed treatment. 5. Documenting the decision-making process meticulously. Question 3. The audit findings indicate a consistent deviation from the prescribed dose escalation protocol in a specific patient cohort, with a trend towards underdosing in a significant proportion of cases. What is the most appropriate initial step to address this critical quality assurance issue? Option A. Implement a temporary hold on treatments for the affected patient cohort until the discrepancy can be fully understood and rectified. Option B. Immediately revise the treatment planning system parameters to enforce the prescribed dose escalation for all future patients in this cohort. Option C. Convene a departmental meeting to discuss the audit findings and reach a consensus on how to proceed based on collective experience. Option D. Initiate a formal risk assessment to systematically evaluate the potential clinical consequences of the observed underdosing and identify contributing factors. The correct answer is D. Initiate a formal risk assessment to systematically evaluate the potential clinical consequences of the observed underdosing and identify contributing factors. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a discrepancy between established quality assurance protocols and the practical application of radiation therapy techniques. The audit findings highlight a potential gap in patient safety and treatment efficacy, necessitating a thorough risk assessment to identify the root cause and implement appropriate corrective actions. The challenge lies in balancing the need for immediate patient care with the imperative to uphold the highest standards of radiation oncology practice, as mandated by professional bodies and regulatory guidelines. Correct approach analysis. The correct approach involves a systematic and evidence-based risk assessment. This aligns with the core principles of clinical governance and patient safety, which are paramount in radiation oncology. By meticulously evaluating the potential risks associated with the observed practice, such as underdosing, overdosing, or inadequate target coverage, clinicians can identify specific areas for improvement. This process is underpinned by the professional duty of care and the ethical obligation to provide safe and effective treatment. Adherence to guidelines from bodies like the Royal College of Radiologists, RCR, ensures that practice remains aligned with current best practices and regulatory expectations for quality assurance in radiotherapy. Incorrect approaches analysis. Failing to conduct a formal risk assessment and instead relying on anecdotal evidence or immediate departmental consensus represents a failure in systematic quality improvement. This approach risks overlooking subtle but significant risks and does not provide a robust basis for evidence-based decision-making. It deviates from the principles of clinical governance, which mandate structured review and evaluation of clinical practice. Implementing changes based solely on the audit findings without a preceding risk assessment can lead to reactive rather than proactive improvements. This might result in the introduction of new, unforeseen risks or the failure to address the most critical issues effectively. It bypasses the crucial step of understanding the magnitude and likelihood of potential harm, which is the essence of risk management. Focusing exclusively on the technical aspects of the treatment planning system without considering the clinical implications and the human factors involved in treatment delivery is also an incomplete approach. While technical accuracy is vital, the ultimate goal is patient benefit, which requires a holistic view encompassing clinical decision-making, patient positioning, and quality assurance checks throughout the treatment pathway. This narrow focus neglects the broader risk landscape. Professional reasoning. When faced with audit findings that suggest a deviation from best practice, the professional reasoning process should begin with a commitment to patient safety and quality improvement. The first step is to acknowledge the findings and initiate a structured risk assessment. This involves defining the problem, identifying potential hazards, analyzing the likelihood and severity of harm, and evaluating existing controls. Based on this assessment, a plan for mitigation and improvement should be developed, implemented, and monitored. This systematic approach ensures that decisions are evidence-based, ethically sound, and in compliance with professional standards and regulatory requirements. Question 4. Research into a novel targeted therapy for a rare form of advanced cancer has shown promising preclinical results and early-phase safety data in a small cohort. A patient with this condition, for whom standard treatments have failed, is seeking any potential avenue for treatment. The clinician is aware of this investigational drug and its potential availability through a compassionate use program or a formal clinical trial. The clinician must decide how to proceed with discussing this option with the patient. Option A. Discuss the investigational drug as a potential treatment option, outlining its experimental nature, known and potential risks and benefits, and the process for accessing it through a formal clinical trial or compassionate use, ensuring comprehensive informed consent is obtained. Option B. Advise the patient that the investigational drug is a viable last resort option and can be prescribed immediately, given the patient's dire prognosis and the drug's potential to extend life. Option C. Administer the investigational drug under a compassionate use designation without formally enrolling the patient in a trial, as the preclinical data is encouraging and the patient has exhausted all other options. Option D. Inform the patient that while there is an experimental drug showing some promise, it is not yet proven and should only be considered if all other standard treatments have been exhausted, without detailing the specific risks and benefits of the investigational drug. The correct answer is A. Discuss the investigational drug as a potential treatment option, outlining its experimental nature, known and potential risks and benefits, and the process for accessing it through a formal clinical trial or compassionate use, ensuring comprehensive informed consent is obtained. Explanation. Scenario analysis. This scenario presents a common yet complex ethical and professional challenge in clinical oncology, balancing the pursuit of novel treatments with the established principles of patient safety and informed consent, particularly when dealing with potentially life-extending but unproven therapies. The challenge lies in navigating the gray area between experimental research and standard care, ensuring that patient autonomy is respected while upholding the highest standards of medical practice and regulatory compliance. The pressure to offer hope, coupled with the inherent uncertainties of early-stage research, can create a difficult decision-making environment. Correct approach analysis. The correct approach prioritizes patient well-being and adherence to established research ethics and regulatory frameworks. This involves a thorough assessment of the available evidence, a clear and comprehensive discussion with the patient about the experimental nature of the treatment, its potential benefits and risks, and the availability of alternative, evidence-based options. It necessitates obtaining fully informed consent, ensuring the patient understands they are participating in a trial with unknown outcomes. This aligns with the principles of beneficence, non-maleficence, and patient autonomy, as well as the regulatory requirements for conducting clinical trials and administering investigational medicinal products, which are overseen by bodies like the Medicines and Healthcare Products Regulatory Agency, MHRA, in the UK. The process must also involve appropriate Institutional Review Board, ERB, or Ethics Committee approval. Incorrect approaches analysis. Offering the investigational drug without formal trial enrollment or ethical approval represents a significant regulatory and ethical failure. This bypasses essential safety checks, informed consent processes, and data collection mechanisms designed to protect patients and advance medical knowledge. It violates the principles of justice and non-maleficence by exposing the patient to unmonitored risks. This constitutes an unauthorized use of an investigational product and breaches the Human Tissue Act and clinical trial regulations. Suggesting the drug as a last resort, without fully disclosing its experimental status and potential lack of efficacy, is misleading and constitutes a breach of informed consent. It exploits the patient's vulnerability and desperation, undermining their autonomy. This is ethically unacceptable and potentially fraudulent, as it misrepresents the nature of the treatment. Proceeding with the drug based solely on anecdotal evidence or the enthusiasm of a colleague, without rigorous review of preclinical data or a formal research protocol, demonstrates a failure to adhere to scientific principles and regulatory oversight. This approach neglects the systematic evaluation required for new treatments and prioritizes enthusiasm over evidence-based practice, potentially leading to harm. It disregards the rigorous peer review and approval processes mandated for clinical research. Professional reasoning. Professionals should approach such situations by first grounding themselves in the established ethical principles of medical practice: beneficence, non-maleficence, autonomy, and justice. They must then consult relevant regulatory guidelines and institutional policies governing clinical research and the use of investigational drugs. A structured decision-making process involves 1. Evidence appraisal. Critically evaluate all available data on the investigational treatment. 2. Risk-benefit analysis. Conduct a thorough assessment of potential benefits versus known and unknown risks for the individual patient. 3. Patient-centered discussion. Engage in open, honest, and comprehensive communication with the patient and their family, ensuring they understand the experimental nature, potential outcomes, and alternatives. 4. Informed consent. Obtain explicit, informed consent that reflects the patient's understanding and voluntary agreement. 5. Ethical and regulatory approval. Ensure all necessary approvals from ethics committees and regulatory bodies are secured before proceeding. 6. Multidisciplinary input. Seek advice from colleagues, research teams, and ethics committees as needed. Question 5. Market research demonstrates a growing interest in the application of stereotactic radiosurgery, SRS, and stereotactic body radiotherapy, SBRT, for indications beyond their established evidence base. A clinical oncologist is considering using SBRT for a rare, locally advanced tumor where standard treatment options have failed, and there is limited published data on SBRT efficacy and toxicity for this specific histology. Which of the following represents the most appropriate approach to managing this situation within the UK regulatory framework? Option A. Proceed with SBRT treatment immediately, relying on the oncologist's clinical experience and the general understanding of SBRT potential benefits for advanced tumors. Option B. Decline SBRT treatment due to the lack of established evidence for this specific indication, recommending only palliative care. Option C. Undertake a comprehensive literature review and seek formal approval from an institutional ethics committee or research governance for a prospective study protocol before commencing treatment. Option D. Initiate SBRT treatment after a thorough individual patient risk-benefit assessment and obtaining comprehensive informed consent, with a plan for close monitoring and data collection. The correct answer is D. Initiate SBRT treatment after a thorough individual patient risk-benefit assessment and obtaining comprehensive informed consent, with a plan for close monitoring and data collection. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent risks associated with stereotactic radiosurgery, SRS, and stereotactic body radiotherapy, SBRT, particularly when considering novel or off-label applications. The need to balance potential patient benefit with established safety protocols and regulatory compliance is paramount. The decision-making process requires a thorough risk-benefit assessment, adherence to evidence-based practice, and a clear understanding of the regulatory framework governing advanced radiotherapy techniques within the UK. Correct approach analysis. The correct approach prioritizes patient safety and adherence to established clinical governance and regulatory guidelines. This involves a comprehensive review of existing evidence for the proposed indication, consultation with multidisciplinary teams, and a formal risk assessment process that considers potential toxicities, efficacy, and the availability of alternative treatments. The decision to proceed with an off-label use of SRS/SBRT should only be made within a framework of approved research protocols or exceptional circumstances, with full informed consent and robust patient monitoring, aligning with the principles of good clinical practice and the guidance from bodies such as the Royal College of Radiologists, RCR, and the Medicines and Healthcare Products Regulatory Agency, MHRA, regarding novel treatments. Incorrect approach is analysis. An approach that bypasses formal risk assessment and multidisciplinary review for an off-label indication is professionally unacceptable. This constitutes a failure to adhere to the principles of clinical governance and patient safety, potentially exposing patients to undue harm without adequate justification or oversight. Such an approach may contravene guidelines from the RCR and the General Medical Council, GMC, regarding responsible medical practice and the use of unproven treatments. Another incorrect approach would be to proceed based solely on anecdotal evidence or personal experience, without seeking peer review or formal ethical approval. This disregards the need for robust evidence generation and validation, which is a cornerstone of safe and effective clinical practice in the UK. It also fails to acknowledge the regulatory requirements for introducing new treatment paradigms. Failing to obtain comprehensive informed consent, specifically detailing the off-label nature of the treatment, potential risks, and the lack of established evidence for the proposed indication, represents a significant ethical and regulatory failure. Patients have a right to understand the full implications of their treatment, and any deviation from standard practice must be transparently communicated. Professional reasoning. Professionals should adopt a systematic decision-making process when considering advanced radiotherapy techniques like SRS/SBRT for novel or off-label indications. This process should include 1. Evidence appraisal, critically evaluating the existing literature for the proposed indication. 2. Multidisciplinary team (MDT) discussion, presenting the case to relevant specialists to gain diverse perspectives and ensure comprehensive patient assessment. 3. Risk-benefit analysis, quantifying potential benefits against known and potential risks, considering patient-specific factors. 4. Governance and ethics review, seeking approval from relevant institutional review boards or ethics committees, especially for off-label use or research protocols. 5. Informed consent, ensuring the patient fully understands the treatment rationale, risks, benefits, and alternatives. 6. Monitoring and audit, establishing robust plans for patient follow-up and data collection to assess outcomes and toxicity. This structured approach ensures patient safety, ethical conduct, and compliance with UK regulatory frameworks. Question 6. The evaluation methodology shows a clinical oncology patient presenting with advanced disease refractory to standard chemotherapy. Preliminary molecular profiling of the tumor reveals a specific actionable mutation for which targeted therapies exist, though not all are routinely commissioned by the NHS for this indication. Which of the following represents the most appropriate next step in management? Adhering to UK regulatory and ethical guidelines for clinical oncologists. Option A. Defer any further investigation or treatment related to the genetic findings, as the targeted therapies are not routinely commissioned and may not be readily accessible. Option B. Discuss the genetic findings with the patient, outlining the potential benefits and risks of available targeted therapies, including off-label use in clinical trials, and explore their preferences for further management. Option C. Proceed with standard palliative care without further consideration of the genetic profile, as the patient has already failed first-line treatment. Option D. Initiate a targeted therapy based on the identified mutation, assuming it will be effective, and seeking retrospective approval if necessary. The correct answer is D. Initiate a targeted therapy based on the identified mutation, assuming it will be effective, and seeking retrospective approval if necessary. Explanation. The evaluation methodology shows a scenario where a clinical oncologist is presented with a patient whose cancer has demonstrated resistance to standard therapy, with preliminary genetic testing suggesting a specific actionable mutation. The professional challenge lies in integrating complex genetic information into clinical decision-making within the established regulatory and ethical frameworks governing cancer treatment in the UK, specifically as it pertains to the fellowship of the Royal College of Radiologists Clinical Oncology exam. This requires not only understanding the biological implications of the genetic findings, but also navigating the availability of targeted therapies, the evidence base supporting their use, and the requirements for informed consent. The correct approach represents best professional practice because it prioritizes patient-centered care, evidence-based medicine, and adherence to the General Medical Council (GMC) guidelines on good medical practice. Specifically, it involves a thorough discussion with the patient about the implications of the genetic findings, the potential benefits and risks of off-label or novel targeted therapies, and the importance of shared decision-making. This aligns with the GMC's emphasis on respecting patient autonomy and ensuring they are adequately informed to make decisions about their care. Furthermore, it necessitates consultation with multidisciplinary teams, including clinical geneticists and molecular pathologists, to ensure the most accurate interpretation of the genetic data and the most appropriate treatment strategy, reflecting the collaborative nature of modern cancer care. The approach also implicitly acknowledges the need to consider NICE guidelines and other relevant UK health technology assessments when evaluating the appropriateness and availability of novel treatments. An incorrect approach that involves immediately prescribing a targeted therapy based solely on the genetic finding, without a comprehensive discussion of risks, benefits, and alternatives, fails to uphold the principle of informed consent and patient autonomy, a cornerstone of GMC guidance. This could lead to inappropriate treatment, patient harm, and a breach of professional duty. Another incorrect approach, such as dismissing the genetic findings as irrelevant due to a lack of immediate availability of a specific drug within the NHS, ignores the evolving landscape of cancer treatment and the potential for compassionate use or access to clinical trials. This demonstrates a failure to stay abreast of medical advancements and a lack of commitment to exploring all viable treatment options for the patient, potentially contravening the GMC's expectation that doctors maintain their professional knowledge and skills. A third incorrect approach, focusing solely on the genetic mutation without considering the patient's overall clinical status, performance status, and comorbidities, is a reductionist view of cancer management. It neglects the holistic assessment required for optimal patient care and fails to consider the broader impact of treatment on the patient's quality of life, which is a fundamental ethical consideration. The professional reasoning process in such situations should involve a systematic evaluation. First, confirming the accuracy and clinical significance of the genetic finding. Second, assessing the patient's overall health and suitability for potential targeted therapies. Third, thoroughly discussing the implications of the genetic finding, including potential treatment options, both licensed and unlicensed, including clinical trials, their efficacy, toxicity, and the evidence base. Fourth, engaging in shared decision-making with the patient, respecting their values and preferences. And fifth, consulting with relevant specialists and multidisciplinary teams to formulate a comprehensive and individualized treatment plan, always within the ethical and regulatory framework of UK medical practice. Question 7. Which approach would be most appropriate for ensuring the accuracy and clinical relevance of dose calculations in complex radiotherapy planning, considering the need for patient safety and adherence to RCR guidelines? Option A. Relying exclusively on the automated dose calculation engine within the treatment planning system, assuming its algorithms are inherently accurate for all patient presentations. Option B. Utilizing the most recently released version of the treatment planning system's dose calculation algorithm without independent clinical validation or peer review. Option C. Prioritizing the speed of treatment plan generation by minimizing the time spent on dose calculation verification to expedite patient treatment commencement. Option D. Implementing a multi-stage review process involving the physicist, oncologist, and radiographer, with a final sign-off by a senior clinician to verify dose calculations against clinical protocols and patient-specific anatomy. Correct answer is D. Implementing a multi-stage review process involving the physicist, oncologist, and radiographer, with a final sign-off by a senior clinician to verify dose calculations against clinical protocols and patient-specific anatomy. Explanation. This scenario presents a professional challenge due to the inherent variability in patient anatomy and treatment response, necessitating a robust and adaptable dosimetry approach. The need to ensure accurate dose delivery while minimizing toxicity requires careful consideration of multiple factors beyond simple algorithmic calculations. The professional challenge lies in balancing the theoretical precision of dose calculation with the practical realities of patient variability and the limitations of current technology. The correct approach represents best professional practice by acknowledging the limitations of purely automated systems and incorporating expert clinical judgment. This aligns with the fellowship of the Royal College of Radiologists, RCR guidelines, which emphasize the importance of peer review and clinical oversight in radiotherapy planning. Specifically, RCR guidance stresses the need for individualized treatment planning and verification, ensuring that calculated doses are clinically appropriate and safe for the patient. This approach upholds the ethical duty of care by prioritizing patient safety and optimal treatment outcomes through a multifaceted review process. An incorrect approach that relies solely on automated dose calculation without clinical review fails to meet RCR standards. This oversight can lead to significant errors if the algorithm does not adequately account for specific anatomical variations, or if there are unforeseen issues with the treatment planning system. Such a failure constitutes a breach of professional responsibility and potentially patient harm, as it bypasses essential quality assurance steps. Another incorrect approach that prioritizes speed of planning over thoroughness would also be professionally unacceptable. While efficiency is desirable, it must not compromise the accuracy and safety of the dose calculation and delivery. RCR guidelines implicitly advocate for a thorough and unhurried planning process, especially for complex cases, to ensure all potential issues are identified and addressed. A further incorrect approach that involves using outdated or unvalidated dose calculation algorithms would be a direct contravention of best practice and RCR recommendations. The RCR mandates the use of current, evidence-based methodologies for dose calculation to ensure accuracy and consistency in treatment delivery. Failure to do so introduces an unacceptable level of uncertainty and risk. The professional reasoning process for similar situations should involve a systematic review of the treatment plan, including the dose calculation. This should encompass an independent check of the dose distribution against established clinical protocols and dose constraints, consideration of patient-specific factors, and a peer review of the plan. The decision-making framework should prioritize patient safety, adherence to regulatory guidelines, such as those from the RCR, and the achievement of optimal therapeutic benefit. Question 8. The review process indicates that a patient undergoing palliative radiotherapy for advanced lung cancer is experiencing severe mucositis and dysphagia, significantly impacting their oral intake and quality of life. They express considerable distress and a desire to stop treatment. As the clinical oncologist, what is the most appropriate immediate course of action? Option A. Reassure the patient that these side effects are expected and unavoidable, advising them to persevere with the current treatment regimen. Option B. Prescribe high-dose opioid analgesia to manage the pain associated with mucositis, without further investigation into the severity or cause. Option C. Offer immediate cessation of radiotherapy and focus solely on supportive care. Option D. Arrange for a detailed assessment of the mucositis and dysphagia, explore options for pain and symptom management, and discuss potential treatment modifications with the patient. The correct answer is C. Offer immediate cessation of radiotherapy and focus solely on supportive care. Explanation. Scenario analysis. This scenario presents a common yet ethically complex situation in clinical oncology. A patient experiencing significant, debilitating side effects from radiation therapy, which are impacting their quality of life and potentially their ability to adhere to treatment, requires careful and empathetic management. The challenge lies in balancing the need to continue curative or palliative treatment with the imperative to alleviate suffering and maintain patient well-being. The physician must navigate the patient's distress, their own clinical judgment regarding treatment efficacy, and the ethical duty of care. Correct approach analysis. The correct approach prioritizes patient well-being and adherence to treatment by actively seeking to manage the side effects. This aligns with the General Medical Council's (GMC) guidance on good medical practice, which emphasizes treating patients with respect, dignity, and compassion, and ensuring their needs are met. Specifically, it reflects the principle of beneficence acting in the patient's best interest and non-maleficence avoiding harm. By offering symptomatic relief and exploring dose modification, the clinician demonstrates a commitment to minimizing the adverse consequences of treatment, thereby improving the patient's quality of life and potentially enabling them to complete their prescribed course of therapy, which is crucial for optimal outcomes. This proactive management is also in line with the principles of shared decision-making, where the patient's experience and concerns are central to treatment planning. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's concerns or minimize their experience, suggesting that the side effects are an unavoidable consequence of treatment and that the patient must simply endure them. This fails to uphold the GMC standards for compassionate care and respect for patient dignity. It can lead to patient distress, loss of trust, and potential non-adherence to treatment, ultimately harming the patient. Ethically, this approach breaches the duty of care by neglecting the patient's suffering. Another incorrect approach would be to immediately cease treatment without a thorough assessment of the side effects and exploration of management strategies. Patient safety is paramount. An abrupt cessation without considering alternatives or the potential impact on treatment efficacy could be detrimental to the patient's prognosis. This might be driven by a desire to avoid further complications, but fails to explore less drastic interventions that could allow treatment to continue. It neglects the principle of proportionality, where interventions should be balanced against potential benefits and harms. A further incorrect approach might involve prescribing strong, potentially sedating medications for symptom relief without adequately assessing the underlying cause of the side effects or considering their impact on the patient's overall function and cognitive status. While symptom control is important, it should be targeted and judicious, avoiding the creation of new problems. This could be seen as a failure to provide holistic care, focusing solely on symptom suppression rather than comprehensive management. Professional reasoning. When faced with a patient experiencing significant side effects, the professional decision-making process should involve 1. Active listening and empathy. Acknowledge and validate the patient's experience. 2. Thorough assessment. Systematically evaluate the nature, severity, and impact of the side effects. 3. Differential diagnosis. Consider potential causes of the symptoms, including treatment-related effects, progression of disease, or unrelated issues. 4. Exploration of management options. Discuss available strategies for symptom relief, including pharmacological and non-pharmacological interventions. 5. Treatment modification discussion. If appropriate, consider dose reduction, fractionation changes, or temporary breaks in treatment, weighing the potential benefits against risks to efficacy. 6. Shared decision-making. Involve the patient in all decisions regarding their care, ensuring they understand the options, risks, and benefits. 7. Ongoing monitoring. Regularly reassess the patient's response to interventions and adjust the management plan as needed. Question 9. The analysis reveals a 65-year-old male patient undergoing chemotherapy for metastatic colorectal cancer, presents to the Oncology Day Unit with a 24-hour history of fever 38, 5 degrees C, rigors, and generalized malaise. He is currently on day 5 of his second cycle of FOLFOX. On examination, he is tachycardic, 110 BPM, and hypotensive, 90/60 mmHg, with no focal signs of infection. His last neutrophil count performed prior to chemotherapy was 2,5x10⁹L. What is the most appropriate immediate management step? Option A. Administer intravenous broad-spectrum antibiotics and intravenous fluids. Option B. Initiate antiemetic therapy and monitor vital signs closely. Option C. Obtain blood cultures and urine microscopy, then commence empirical oral antibiotics. Option D. Schedule urgent imaging of the chest and abdomen to identify a source of infection. The correct answer is A. Administer intravenous broad-spectrum antibiotics and intravenous fluids. Explanation. Scenario analysis. This scenario presents a common yet challenging clinical situation where a patient experiences a significant and potentially life-threatening chemotherapy-induced side effect. The challenge lies in rapidly and accurately identifying the cause, differentiating it from other potential diagnoses, and initiating appropriate management while considering the patient's overall treatment plan and well-being. The urgency of the situation, coupled with the need for precise clinical judgment, makes this professionally demanding. Correct approach analysis. The correct approach prioritizes immediate assessment and management of the most likely and dangerous cause of the patient's symptoms. This aligns with the principles of good medical practice and the professional duty of care, which mandates prompt and effective intervention in acute situations. Specifically, in the context of chemotherapy, neutropenic sepsis is a critical emergency requiring immediate broad-spectrum antibiotics. This approach is supported by clinical guidelines and best practice recommendations for managing chemotherapy-induced neutropenia, aiming to prevent rapid deterioration and mortality. Incorrect approaches analysis. One incorrect approach might involve delaying definitive management to await further investigations that are not immediately critical. This could lead to a delay in administering essential antibiotics, allowing sepsis to progress, which is a failure of the duty of care and potentially breaches professional standards regarding timely patient management. Another incorrect approach could be to manage the symptoms symptomatically without addressing the underlying cause. For instance, solely administering antiemetics without considering the possibility of sepsis would be a significant oversight, potentially masking a critical condition and leading to adverse outcomes. This demonstrates a lack of comprehensive clinical assessment and adherence to established protocols for managing chemotherapy complications. A further incorrect approach might be to prematurely stop chemotherapy without a clear indication or consultation. While dose modification or interruption is sometimes necessary, making such a decision without a thorough evaluation of the current situation and its implications for the patient's overall treatment efficacy would be unprofessional and potentially detrimental to the patient's long-term prognosis. This deviates from evidence-based treatment pathways and personalized care. Professional reasoning. Professionals should adopt a systematic approach to acute presentations in oncology patients receiving chemotherapy. This involves a rapid assessment of vital signs, a focused history and examination, and prompt consideration of the most common and serious chemotherapy-related toxicities. A high index of suspicion for neutropenic sepsis is crucial. Decision-making should be guided by established clinical protocols, patient-specific factors, and a clear understanding of the potential consequences of delayed or incorrect management. Collaboration with multidisciplinary teams, including microbiology and critical care if necessary, is also a key component of effective patient care. Question 10. Risk assessment procedures indicate a deviation from the standard quality assurance protocol during the planning of a patient's radiotherapy treatment. The deviation involved a minor discrepancy in the calculated dose distribution compared to the planned target volume, which was identified by the medical physics team prior to treatment delivery. The The treating clinical oncologist is considering several courses of action. Which of the following represents the most appropriate professional response? Option A. Initiate a formal root cause analysis, assess the clinical significance of the dose discrepancy for the individual patient, and document all findings and corrective actions. Option B. Immediately replan the patient's treatment to ensure the original plan is perfectly replicated, without further investigation into the cause of the discrepancy. Option C. Consider the discrepancy minor and proceed with treatment as planned, assuming the physics team will catch any significant issues in the future. Option D. Inform the patient that a minor error occurred, but assure them it will not affect their outcome and proceed with the original plan as is. The correct answer is A. Initiate a formal root cause analysis, assess the clinical significance of the dose discrepancy for the individual patient, and document all findings and corrective actions. Explanation. Scenario analysis. This scenario presents a common challenge in clinical oncology where a deviation from a standard quality assurance protocol is identified. Professional challenge lies in balancing the need for rigorous adherence to established safety and efficacy standards with the potential for individual patient benefit or the exploration of novel approaches. The requirement for careful judgment stems from the potential impact on patient safety, treatment outcomes, and the integrity of the department's quality framework. Mismanagement of such a situation could lead to suboptimal patient care, regulatory noncompliance, and erosion of professional trust. Correct approach analysis. The correct approach involves a systematic, evidence-based review and documentation process. This aligns with the principles of good clinical practice and the regulatory expectations for quality assurance in radiation therapy, as mandated by bodies such as the Royal College of Radiologists, RCR. Specifically, it requires a thorough investigation into the cause of the deviation, an assessment of its clinical significance for the patient, and a clear plan for corrective action and future prevention. This approach ensures that patient safety is paramount, that any deviations are understood and managed appropriately, and that the quality assurance system is continuously improved. It upholds the ethical duty of care to the patient and the professional responsibility to maintain high standards of practice. Incorrect approaches analysis. One incorrect approach is to dismiss the deviation as minor without a formal investigation. This fails to uphold the RCR's guidelines on quality assurance, which emphasize the importance of identifying and learning from all deviations, regardless of perceived severity. Ethically, this approach risks overlooking a potentially significant issue that could impact patient safety or treatment efficacy, thereby breaching the duty of care. Another incorrect approach is to immediately implement a change to the protocol without proper evaluation or consultation. This bypasses the established quality assurance framework and could introduce new, unassessed risks. It disregards the need for evidence-based decision-making and peer review, which are fundamental to maintaining high standards in radiation oncology. This could also lead to inconsistencies in care delivery across the department. A third incorrect approach is to simply retreat the patient without understanding the root cause of the deviation. While seemingly addressing the immediate issue, it fails to prevent recurrence and does not contribute to the overall learning and improvement of the quality assurance system. This reactive approach neglects the proactive measures required by regulatory bodies to ensure ongoing safety and quality. Professional reasoning. Professionals should approach such situations by first acknowledging the deviation and its potential implications. The decision-making process should involve a structured investigation, including consultation with relevant colleagues, e.g., physicists, senior oncologists, and a review of departmental protocols and national guidelines. The focus should be on understanding the why behind the deviation, assessing its impact, and developing a robust plan for remediation and prevention. This systematic approach ensures that patient safety is protected, that learning occurs, and that the department's quality assurance mechanisms are strengthened, thereby upholding professional standards and regulatory compliance. Question 11. System analysis indicates that a patient with advanced non-small cell lung cancer has moderate renal impairment, eGFR 30 ml/min/1, 73 m2. The multidisciplinary team is considering platinum-based chemotherapy, a cornerstone of treatment for this condition. What is the most appropriate principle to guide the selection and administration of chemotherapy in this scenario, adhering strictly to UK clinical oncology practice and RCR guidelines? Option A. Administer standard dosing of a platinum-based chemotherapy regimen, as the oncological benefit is considered paramount and renal impairment is a manageable side effect. Option B. Withhold all chemotherapy due to the significant renal impairment, as the risk of exacerbating kidney damage outweighs any potential oncological benefit. Option C. Prioritize the use of chemotherapy regimens with the lowest known nephrotoxic potential, employing dose adjustments based on established renal function guidelines, and consider alternative agents if standard platinum-based regimens are deemed too high risk. Option D. Proceed with an arbitrary reduction in the dose of the chosen platinum-based agent without consulting specific guidelines or specialist advice, assuming this will mitigate nephrotoxicity. The correct answer is C. Prioritize the use of chemotherapy regimens with the lowest known nephrotoxic potential, employing dose adjustments based on established renal function guidelines, and consider alternative agents if standard platinum-based regimens are deemed too high risk. Explanation. Scenario analysis. This scenario presents a common challenge in clinical oncology, managing a patient with a significant comorbidity that impacts treatment tolerance and efficacy. The patient's renal impairment necessitates careful consideration of nephrotoxic chemotherapy agents, balancing the potential benefits of treatment against the risks of exacerbating renal dysfunction and causing irreversible damage. The professional challenge lies in optimizing treatment selection and dosing to achieve oncological goals while safeguarding patient safety and adhering to established guidelines, which are paramount in the UK's National Health Service (NHS) framework for cancer care. Correct approach analysis. The correct approach involves a systematic review of the patient's renal function and a thorough assessment of available chemotherapy regimens, considering their known nephrotoxic profiles and dose adjustments for impaired renal clearance. This aligns with the principles of evidence-based medicine and the RCR's guidance on safe chemotherapy administration, which emphasizes individualized patient care and risk stratification. Specifically, it reflects the NHS's commitment to patient safety and the principles of good medical practice, requiring clinicians to act in the best interests of their patients and to practice within their competence. The use of dose-modified regimens or alternative agents with lower nephrotoxicity is a direct application of these principles, aiming to minimize harm while still offering a chance of therapeutic benefit. This approach is also consistent with the principles of shared decision-making, where the risks and benefits of different treatment options are discussed with the patient. Incorrect approaches analysis. One incorrect approach would be to proceed with standard dosing of a known nephrotoxic agent without any modification. This fails to acknowledge the patient's specific vulnerability due to renal impairment, directly contravening the RCR's emphasis on patient safety and the GMC's guidance on good medical practice, which mandates that doctors must take all reasonable steps to ensure the safety of patients under their care. Such an approach risks severe adverse events, including acute kidney injury and potentially irreversible renal damage, leading to significant patient harm and potential professional misconduct. Another incorrect approach would be to withhold all chemotherapy due to the renal impairment, without exploring alternative strategies. While patient safety is paramount, a blanket refusal to consider treatment options may not be in the patient's best oncological interest, especially if less nephrotoxic regimens or supportive measures could be employed. This could be seen as a failure to adequately explore all reasonable treatment avenues and could be challenged under the principles of providing appropriate care and not abandoning patients, as outlined by the GMC. It also fails to consider the potential for palliative benefit or disease control that chemotherapy might offer. A third incorrect approach would be to rely solely on empirical dose reduction without consulting established guidelines or specialist advice. While dose adjustment is necessary, arbitrary reductions may lead to subtherapeutic efficacy, rendering the treatment ineffective, or may still carry unacceptable risks if the chosen agent is inherently highly nephrotoxic. This demonstrates a lack of systematic approach and adherence to best practice, which is expected within the RCR framework and NHS guidelines for chemotherapy prescribing. Professional reasoning. Professionals should adopt a structured approach to managing complex cases like this. This involves 1. Comprehensive assessment of the patient's comorbidities and their impact on treatment tolerance. 2. Thorough review of relevant clinical guidelines and evidence for chemotherapy options in the context of renal impairment. 3. Consideration of dose adjustments, alternative agents, or non-pharmacological treatment modalities. 4. Multidisciplinary team discussion to ensure a consensus on the optimal management plan. 5. Open and honest communication with the patient regarding the risks, benefits, and uncertainties of all proposed treatment strategies. Facilitating informed consent. This systematic process ensures that patient safety is prioritized while striving for the best possible oncological outcome, in line with professional and regulatory expectations. Question 12. During the evaluation of a 55-year-old patient with no specific symptoms or family history of cancer, they inquire about the rationale and their eligibility for the NHS bowel cancer screening program. They express some apprehension about the potential for false positives and the implications of an abnormal result. Which of the following approaches best reflects current UK clinical oncology practice and ethical guidelines in addressing this patient's query? Option A. Provide a detailed explanation of the NHS bowel cancer screening program, including its evidence base, the benefits of early detection, the potential harms such as false positives and overdiagnosis, and discuss the patient's individual understanding and concerns to facilitate a shared decision. Option B. Advise the patient that given their age and lack of symptoms or family history, participation in the screening program is not particularly beneficial and may lead to unnecessary anxiety. Option C. Strongly encourage the patient to participate in the screening program immediately, emphasizing that early detection is paramount and any potential harms are outweighed by the significant survival benefits. Option D. Inform the patient that screening programs are complex and that they should consult a specialist website for detailed information, as individual recommendations are beyond the scope of a routine consultation. The correct answer is A. Provide a detailed explanation of the NHS bowel cancer screening program, including its evidence base, the benefits of early detection, the potential harms such as false positives and overdiagnosis, and discuss the patient's individual understanding and concerns to facilitate a shared decision. Explanation. This scenario presents a common challenge in clinical oncology, balancing the benefits of population-level screening with individual patient autonomy and the potential for overdiagnosis and overtreatment. The professional challenge lies in providing accurate, evidence-based information to a patient who is seeking guidance on a screening test, while respecting their right to make an informed decision. The National Health Service, NHS, screening programs, as governed by UK regulations and NICE guidelines, are designed to offer a net benefit to the population. However, individual uptake and decision-making require careful consideration of personal risk factors, patient preferences, and the limitations of screening. The correct approach represents best professional practice because it prioritizes shared decision-making, which is a cornerstone of ethical medical practice in the UK. This involves providing comprehensive, unbiased information about the specific screening program, including its benefits, early detection, improved outcomes, harms, false positives, false negatives, overdiagnosis, anxiety, potential for unnecessary procedures, and the evidence base supporting its use. It also involves assessing the patient's understanding, values, and concerns, and tailoring the discussion accordingly. This aligns with the General Medical Council's (GMC) guidance on good medical practice, which emphasizes the importance of clear communication and respecting patient autonomy. An incorrect approach that focuses solely on the patient's age and a general recommendation for screening, without discussing the specifics of the NHS program or the patient's individual context, fails to meet the standards of informed consent. This approach risks paternalism and does not empower the patient to make a truly informed choice. It may also overlook individual contraindications or specific risk factors that might influence the decision. Another incorrect approach that dismisses the screening program as unnecessary or potentially harmful without presenting the evidence or acknowledging the population benefits would be equally unprofessional. This could stem from personal bias or a misunderstanding of the program's rationale and evidence base, and it undermines patient trust in the established public health initiatives. A further incorrect approach that pressures the patient into a specific decision, whether for or against screening, violates the principle of patient autonomy. The clinician's role is to facilitate informed decision-making, not to dictate it. This can lead to regret and erode the patient-physician relationship. The professional reasoning process for such situations should involve 1. Understanding the specific screening program in question, its indications, benefits, harms, and the evidence supporting its implementation, e.g., NICE guidelines, NHS policy. 2. assessing the individual patient's context, including their understanding of health, their values, their concerns, and any personal risk factors that may or may not be addressed by the general screening program. 3. Engaging in a balanced, evidence-based discussion about the screening test, ensuring the patient comprehends both the potential advantages and disadvantages. 4. Facilitating shared decision-making, allowing the patient to weigh the information according to their own priorities and make a choice that aligns with their values. 5. Documenting the discussion and the patient's decision clearly in the medical record. Question 13. Stakeholder feedback indicates that patients sometimes express a desire to refuse potentially life-prolonging treatment due to overwhelming emotional distress. As a clinical oncologist, what is the most appropriate initial approach when a patient expresses such a wish, and what are the underlying principles guiding this decision-making process? Option A. Politely but firmly explain why their decision is not in their best interest and strongly advocate for them to accept the recommended treatment. Option B. Engage in a detailed discussion to understand the patient's reasoning, explore their values and concerns, assess their capacity to make this decision, and offer further support or information, potentially involving the wider multidisciplinary team. Option C. Acknowledge their distress but proceed with the treatment plan as initially discussed, assuming their distress will subside and they will eventually agree. Option D. Immediately respect the patient's stated wish to refuse treatment, as patient autonomy is paramount and overrides all other considerations. The correct answer is B. Engage in a detailed discussion to understand the patient's reasoning, explore their values and concerns, assess their capacity to make this decision, and offer further support or information, potentially involving the wider multidisciplinary team. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent complexity of balancing patient autonomy with the clinician's duty of care, particularly when faced with a patient's potentially suboptimal decision-making capacity due to distress. The oncologist must navigate the ethical imperative to respect patient wishes while ensuring the patient understands the implications of their choices and is making them in their best interest, free from undue influence or impaired judgment. This requires a nuanced approach that goes beyond simply accepting or rejecting the patient's stated preference. Correct approach analysis. The correct approach prioritizes a thorough assessment of the patient's understanding and capacity, coupled with empathetic communication and exploration of their values and concerns. This aligns with the core principles of clinical oncology practice, which are underpinned by GMC guidance on decision-making and consent. Specifically, it reflects the requirement to ensure patients are fully informed, understand the risks and benefits of treatment options, including no treatment, and have the capacity to make decisions. By offering further discussion, exploring the patient's reasoning, and involving a multidisciplinary team if necessary, the oncologist demonstrates a commitment to shared decision-making and patient-centered care, ensuring the patient's autonomy is respected within the bounds of safe and ethical practice. This approach upholds the principle of beneficence by ensuring the patient's well-being is paramount. Incorrect approaches analysis. One incorrect approach involves immediately overriding the patient's wishes based on the oncologist's own assessment of what is best, without a thorough exploration of the patient's reasoning or capacity. This fails to uphold the principle of patient autonomy and can be seen as paternalistic, potentially leading to a breakdown in the doctor-patient relationship and a failure to identify underlying issues affecting the patient's decision. It may also contravene GMC guidance on respecting patient choice. Another incorrect approach is to simply accept the patient's decision without further investigation, even if there are clear indicators of distress or potential impairment of judgment. This neglects the oncologist's duty of care to ensure the patient is making an informed decision and could lead to a suboptimal outcome for the patient if their decision is not truly in their best interest due to factors they are unable to articulate. This approach risks failing to meet the standards of good medical practice regarding patient assessment and informed consent. A third incorrect approach involves pressuring the patient to change their mind through repeated or forceful arguments without first understanding the root of their decision. This can be coercive and undermine the patient's autonomy and trust. It fails to acknowledge the patient's emotional state and may alienate them, making it harder to achieve a shared understanding or a decision that is truly in their best interest. This approach is ethically unsound and can damage the therapeutic alliance. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening and empathetic engagement. This involves understanding the patient's perspective, identifying any potential barriers to decision-making, such as distress, fear, or lack of understanding, and then systematically assessing their capacity. If capacity is in doubt, further assessment and support are required. The process should always aim for shared decision-making, where the patient's values and preferences are central, but balanced against the clinician's professional judgment and ethical obligations to ensure the patient's safety and well-being. This iterative process of communication, assessment, and shared decision-making is fundamental to ethical clinical oncology practice. Question 14. Operational review demonstrates a patient with metastatic non-small cell lung cancer and a history of moderate renal impairment and cardiac arrhythmias is being considered for first-line chemotherapy. Several agents with different mechanisms of action are available, which approach best balances the need for effective treatment with the imperative to minimize patient risk. Option A. Select an agent whose mechanism of action is known to be highly effective against non-small cell lung cancer and has a favorable toxicity profile in patients with normal renal and cardiac function, assuming the patient's comorbidities will be managed supportively. Option B. Choose a chemotherapeutic agent that has been widely used in similar cases historically, as established protocols are generally safe and effective, and this approach minimizes the need for complex individualized risk calculations. Option C. Conduct a thorough risk assessment considering the patient's specific renal and cardiac status, performance status, and potential drug interactions, and select an agent whose mechanism of action is appropriate for the tumor type, while also considering its known toxicities in the context of these comorbidities. Option D. Prioritize the agent with the most rapid onset of action to achieve tumor debulking quickly, as this is often associated with better long-term outcomes, and address any emergent toxicities as they arise. The correct answer is A. Select an agent whose mechanism of action is known to be highly effective against non-small cell lung cancer and has a favorable toxicity profile in patients with normal renal and cardiac function, assuming the patient's comorbidities will be managed supportively. Explanation. Scenario analysis. This scenario presents a professional challenge in managing a patient with a complex medical history and a new diagnosis requiring chemotherapy. The challenge lies in selecting the most appropriate chemotherapeutic agent, balancing efficacy against potential toxicity, and ensuring patient safety, all within the context of evolving clinical evidence and individual patient factors. The need for a risk assessment approach is paramount due to the inherent dangers of cytotoxic agents and the potential for significant adverse events, which could impact patient quality of life and treatment outcomes. Correct approach analysis. The correct approach involves a comprehensive risk assessment that integrates patient-specific factors with the known mechanisms of action and toxicity profiles of available chemotherapeutic agents. This aligns with best professional practice as outlined by the Royal College of Radiologists, RCR guidelines, which emphasize evidence-based decision-making, patient-centered care, and the principle of beneficence and non-maleficence. A thorough assessment of comorbidities, performance status, and potential drug interactions is crucial to predict and mitigate risks. Understanding the specific mechanism of action of each agent allows for targeted selection that maximizes therapeutic benefit while minimizing harm. This approach ensures that treatment decisions are not only clinically sound, but also ethically defensible, prioritizing the patient's well-being and informed consent. Incorrect approach is analysis. One incorrect approach would be to solely rely on the most recently published clinical trial data without considering the individual patient's profile. This fails to adhere to the principle of personalized medicine and could lead to the selection of an agent that, while effective in a trial population, poses an unacceptable risk to this specific patient due to their unique comorbidities or genetic predispositions. This could be seen as a failure to uphold the RCR's emphasis on individualized treatment plans and could potentially breach ethical obligations regarding patient safety. Another incorrect approach would be to select a chemotherapeutic agent based on historical prescribing patterns or physician preference without a current, systematic risk assessment. This neglects the importance of staying abreast of current evidence and best practices, potentially leading to suboptimal or even harmful treatment choices. It also undermines the principle of evidence-based medicine, which is a cornerstone of professional conduct in clinical oncology. A further incorrect approach would be to prioritize speed of treatment initiation over a thorough risk assessment, perhaps due to perceived time pressures. This could result in overlooking critical contraindications or potential adverse drug reactions, thereby jeopardizing patient safety. Such an approach would be contrary to the RCR's guidance on responsible and safe practice, which mandates careful consideration of all relevant factors before commencing treatment. Professional reasoning. Professionals should adopt a structured decision-making process that begins with a thorough patient assessment, including a detailed medical history, physical examination, and relevant investigations. This should be followed by a comprehensive review of the available evidence regarding the efficacy and toxicity of potential chemotherapeutic agents, with a particular focus on their mechanisms of action and how these relate to the patient's specific disease and physiological status. A risk-benefit analysis, tailored to the individual patient, should then guide the selection of the most appropriate agent. Open communication with the patient, involving shared decision-making and informed consent, is essential throughout this process. Regular monitoring for treatment response and adverse events is also a critical component of ongoing professional responsibility. Question 15. Regulatory review indicates that a novel targeted therapy has shown promising results in early-phase clinical trials for a specific subtype of advanced cancer. However, it has not yet received full marketing authorization from the MHRA, nor has it undergone assessment by NICE for cost-effectiveness. A group of patients with this advanced cancer are expressing strong interest in accessing this therapy, citing anecdotal reports of its success. What is the most appropriate professional approach to managing this situation, ensuring both patient well-being and adherence to regulatory and ethical standards? Option A. Advise patients that the therapy is not an option until it has completed all regulatory assessments and is widely available on the NHS, regardless of the early data. Option B. Prescribe the therapy immediately, as the early data suggests a potential benefit, and inform the MHRA retrospectively about its use. Option C. Advocate for the immediate off-label use of the therapy for these patients, given the promising early data and patient demand, while initiating a local audit to gather further data. Option D. Inform patients about the current regulatory status of the therapy, discuss the available evidence and its limitations, and explore participation in ongoing clinical trials or established treatment options, while awaiting full regulatory approval. The correct answer is C. Advocate for the immediate off-label use of the therapy for these patients, given the promising early data and patient demand, while initiating a local audit to gather further data. Explanation. Scenario analysis. This scenario presents a common challenge in clinical oncology, balancing the rapid advancement of targeted therapies with the established regulatory pathways for their use. The professional challenge lies in ensuring patient access to potentially life-saving treatments, while adhering to the strict requirements of the regulatory framework governing their approval and reimbursement. This requires a nuanced understanding of evidence generation, clinical trial design, and the specific criteria set by regulatory bodies for demonstrating efficacy and safety in a defined patient population. The pressure to offer novel treatments can conflict with the need for robust data and formal approval processes, necessitating careful ethical and professional judgment. Correct approach analysis. The correct approach involves meticulously following the established regulatory pathways for the introduction of novel targeted therapies. This means ensuring that the therapy has undergone rigorous clinical trials, demonstrating a statistically significant and clinically meaningful benefit in the specific patient population for whom it is intended. It requires adherence to the guidelines set by the relevant regulatory authorities, such as the Medicines and Healthcare Products Regulatory Agency, MHRA in the UK, for marketing authorization. Furthermore, for reimbursement and widespread adoption, evidence of cost-effectiveness and a clear place in the treatment algorithm, often assessed by bodies like the National Institute for Health and Care Excellence (NICE), is crucial. This systematic approach ensures patient safety, promotes evidence-based medicine, and maintains the integrity of the healthcare system by ensuring that treatments are both effective and appropriately resourced. Incorrect approaches analysis. One incorrect approach is to advocate for the immediate widespread use of a targeted therapy based solely on promising early-phase data or anecdotal evidence from a small number of patients. This fails to meet the regulatory requirement for robust evidence of efficacy and safety, potentially exposing patients to unproven risks and ineffective treatments. Ethically, it breaches the principle of non-maleficence and beneficence. Another incorrect approach is to bypass formal regulatory approval processes and seek off-label use without a clear, evidence-based rationale supported by the existing literature or a well-designed clinical trial. While off-label use has a place in exceptional circumstances, it must be carefully considered and justified, not used as a default for novel agents lacking full regulatory endorsement. This approach risks inconsistent patient care and potential regulatory scrutiny. A third incorrect approach is to prioritize patient demand or perceived urgency over the established evidence base and regulatory requirements. While patient wishes are important, they cannot override the need for treatments to be proven safe and effective through regulated channels. This can lead to the premature adoption of therapies that may ultimately prove to be harmful or offer no real benefit, undermining trust in the oncology community. Professional reasoning. Professionals should adopt a framework that prioritizes evidence-based decision-making within the established regulatory landscape. This involves staying abreast of emerging research, critically appraising the quality of evidence for new targeted therapies, and understanding the specific requirements of regulatory bodies for approval and reimbursement. When considering novel agents, a systematic process should be followed. 1. Review the available evidence for efficacy and safety in the target patient population. 2. Assess the therapy status with the relevant regulatory authorities, e.g., MHRA for marketing authorization. 3. Consider the recommendations of health technology assessment bodies, e.g., NICE for cost-effectiveness and clinical guidelines. 4. Engage in shared decision-making with patients, clearly communicating the evidence, potential benefits, risks, and the current regulatory status of the therapy. 5. Advocate for appropriate access through established channels, such as clinical trials or approved indications, rather than circumventing regulatory processes. Question 16. The evaluation methodology shows that a patient with locally advanced lung cancer has been presented with a radical radiotherapy treatment plan. The patient expresses significant anxiety about the side effects and asks for more time to consider the options, stating they feel overwhelmed by the information. Which of the following approaches best upholds the principles of informed consent and patient autonomy within the UK regulatory framework? Option A. Schedule a follow-up appointment specifically to discuss the patient's concerns in a calm environment, providing written information and offering to involve a specialist nurse or patient support group to help them process the details before making a decision. Option B. Postpone the discussion about treatment options indefinitely until the patient appears less anxious, as it is not appropriate to make decisions under duress. Option C. Proceed with the treatment as planned, reassuring the patient that the benefits outweigh the risks and that the clinical team will manage any side effects effectively. Option D. Explain the technical aspects of the radiotherapy plan in detail, including dose fractionation and target volumes, to ensure the patient understands the scientific rationale behind the proposed treatment. The correct answer is A. Schedule a follow-up appointment specifically to discuss the patient's concerns in a calm environment, providing written information and offering to involve a specialist nurse or patient support group to help them process the details before making a decision. Explanation. This scenario presents a professional challenge due to the inherent complexity of balancing patient autonomy with the clinician's duty of care, particularly when dealing with potentially life-altering treatment decisions. The need for informed consent is paramount in UK clinical oncology practice, governed by principles enshrined in common law and reinforced by professional guidelines from bodies like the Royal College of Radiologists, RCR, and the General Medical Council, GMC. The challenge lies in ensuring the patient fully comprehends the risks, benefits, and alternatives of a proposed radical radiotherapy regimen for their advanced lung cancer, especially given their expressed anxiety and potential for information overload. The correct approach represents best professional practice because it prioritizes shared decision-making and robust informed consent. This involves a structured, multi-stage discussion that allows the patient to process information at their own pace, ask clarifying questions, and express their values and preferences. It aligns with the GMC's good medical practice guidance, which mandates that doctors must communicate effectively with patients, ensuring they have the information necessary to make decisions about their care. Specifically, it upholds the principle of patient autonomy by respecting their right to make informed choices, even if those choices differ from the clinician's initial recommendation. The use of validated information resources and the offer of a second opinion further strengthen the ethical and legal foundation of this approach. An incorrect approach that focuses solely on presenting the technical details of the radiotherapy plan without adequately assessing the patient's understanding or emotional state fails to meet the requirements of informed consent. This could lead to a legally invalid consent, as the patient may not have truly understood the implications of their decision. Ethically, it breaches the duty to communicate effectively and respect patient autonomy. Another incorrect approach, which involves overriding the patient's expressed concerns and proceeding with treatment based on the clinician's judgment alone, is a direct violation of patient autonomy and the principles of shared decision-making. This constitutes a failure to obtain valid consent and could be considered a form of medical paternalism that is unacceptable in modern UK healthcare. A third incorrect approach, which involves delaying the discussion indefinitely due to the patient's anxiety, fails to uphold the duty to provide timely and appropriate care and information, potentially leading to mistreatment opportunities and a breach of the duty of care. The professional decision-making process for similar situations should involve a systematic assessment of the patient's capacity to understand their current emotional state and their information needs. It requires tailoring communication strategies to the individual, using clear and jargon-free language, and actively seeking feedback to gauge comprehension. Professionals should be prepared to revisit discussions, offer support, and involve other members of the multidisciplinary team, as needed to ensure the patient is empowered to make a truly informed decision. Question 17. Governance review demonstrates that a new, advanced treatment planning technique for radiotherapy has been developed, offering potentially improved dose conformity and reduced toxicity. However, its widespread adoption has not yet been formally evaluated within the department. What is the most appropriate next step to ensure safe and effective implementation? Option A. Defer the adoption of the new technique indefinitely, citing the lack of established departmental protocols and the potential for disruption to current workflows. Option B. Proceed with the immediate department-wide implementation of the new technique, assuming its advanced nature guarantees superior patient outcomes. Option C. Immediately cease all use of the existing planning technique and mandate the adoption of the new technique for all patients to leverage its perceived advantages. Option D. Initiate a phased implementation of the new technique, starting with a pilot study involving a select group of patients and staff, coupled with comprehensive training and ongoing outcome monitoring. The correct answer is D. Initiate a phased implementation of the new technique, starting with a pilot study involving a select group of patients and staff, coupled with comprehensive training and ongoing outcome monitoring. Explanation: scenario analysis. This scenario presents a professional challenge related to the implementation of a new treatment planning technique. The challenge lies in balancing the potential benefits of advanced technology with the imperative to ensure patient safety and adherence to established clinical protocols. The governance review highlights a potential gap between theoretical advancement and practical, safe application, requiring careful judgment to bridge this divide. Correct approach analysis. The correct approach involves a structured, evidence-based evaluation and phased implementation. This aligns with the principles of good clinical governance, which mandate that new technologies or techniques are rigorously assessed for efficacy and safety before widespread adoption. It reflects a commitment to patient welfare, ensuring that any changes to treatment planning are supported by robust data and have undergone appropriate validation. This approach is ethically sound, prioritizing patient safety and informed consent, and is consistent with professional standards for the introduction of new medical technologies, which typically require peer review, pilot studies, and formal training. Incorrect approaches analysis. One incorrect approach would be to immediately adopt the new technique based solely on its perceived technological superiority without adequate validation. This represents a failure in risk assessment and governance, potentially exposing patients to unknown risks or suboptimal outcomes. It breaches the ethical duty of care by not ensuring the technique is proven safe and effective. Another incorrect approach would be to dismiss the new technique entirely without a thorough evaluation. This could lead to a failure to offer patients the most effective or least toxic treatment available, potentially contravening the principle of beneficence and the professional obligation to stay abreast of advancements in the field. It also fails to engage with the potential for improved patient outcomes that new techniques might offer. A further incorrect approach would be to implement the technique without appropriate training for the clinical team. This poses a direct risk to patient safety, as the correct application of advanced planning techniques requires specific skills and knowledge. It is a clear breach of professional responsibility and regulatory expectations regarding staff competency. Professional reasoning. Professionals should approach the introduction of new treatment planning techniques with a systematic process. This involves 1. Identifying the potential benefits and risks of the new technique. 2. Conducting a thorough literature review and seeking expert opinion. 3. Designing and executing a pilot study or validation phase to assess efficacy and safety in the local context. 4. Developing comprehensive training programs for all relevant staff. 5. Establishing clear protocols and quality assurance measures for implementation. 6. Continuously monitoring outcomes and refining the technique as necessary. This structured approach ensures that patient care remains paramount while embracing innovation responsibly. Question 18. Implementation of a chemotherapy regimen for a patient diagnosed with advanced non-small cell lung cancer requires careful consideration of multiple factors. Which of the following approaches best reflects current best practice and regulatory expectations for optimizing treatment selection? Option A. Initiating a novel immunotherapy agent that has shown promising early-phase trial results, without prior confirmation of its efficacy and safety profile in this specific patient population. Option B. Selecting a regimen based on the patient's ECOG performance status, histological subtype, and PD-L1 expression, aligning with current NICE guidelines for advanced NSCLC. Option C. Administering a standard platinum-based doublet chemotherapy regimen that has shown efficacy in a similar patient cohort previously treated for a different malignancy. Option D. Prescribing a high-dose intensity regimen to maximize potential tumor response, irrespective of the patient's comorbidities or tolerance. Correct answer is B. Selecting a regimen based on the patient's ECOG performance status, histological subtype, and PD-L1 expression, aligning with current NICE guidelines for advanced NSCLC. Explanation. Scenario analysis. This scenario presents a common challenge in clinical oncology, optimizing chemotherapy regimens for patients with advanced lung cancer while balancing efficacy, toxicity, and patient-specific factors. The professional challenge lies in navigating evolving evidence-based guidelines, individual patient comorbidities, performance status, and potential drug interactions, all within the context of resource availability and patient preferences. Accurate application of current best practice guidelines is paramount to ensure optimal patient outcomes and adherence to professional standards. Correct approach analysis. The correct approach involves a systematic review of the patient's comprehensive clinical profile against established evidence-based guidelines for advanced non-small cell lung cancer (NSCLC). This includes considering the specific histological subtype, e.g., adenocarcinoma, squamous cell carcinoma, presence of actionable molecular targets, e.g., EGFR, ALK, PD-L1 expression, patient's Eastern Cooperative Oncology Group, ECOG, performance status, renal and hepatic function, and significant comorbidities. Consultation with multidisciplinary teams, including thoracic surgeons, medical oncologists, and radiologists, is often integral to refining treatment decisions. Adherence to NICE guidelines or equivalent UK professional standards for oncology is a fundamental regulatory and ethical requirement, ensuring that treatment is evidence-based and patient-centered. Incorrect approaches analysis. One incorrect approach would be to solely rely on a previously successful regimen used in a different patient population or for a different cancer type, without re-evaluating the current patient's specific circumstances and the latest evidence for NSCLC. This fails to meet the professional obligation to provide personalized care and can lead to suboptimal treatment or unnecessary toxicity, potentially breaching guidelines on evidence-based practice. Another incorrect approach would be to initiate a novel or experimental regimen without robust evidence of its efficacy and safety in the intended patient group, or without appropriate ethical review and patient consent for off-protocol treatment. This disregards the regulatory framework that mandates the use of approved and evidence-supported treatments and poses significant ethical risks to the patient. A third incorrect approach would be to disregard the patient's performance status and comorbidities, opting for an aggressive regimen that the patient is unlikely to tolerate. This demonstrates a failure to apply clinical judgment and adhere to ethical principles of beneficence and non-maleficence, potentially leading to severe adverse events and hospitalization, and contravening guidelines on patient safety. Professional reasoning. Professionals should adopt a structured decision-making process that begins with a thorough assessment of the patient's clinical status, including histology, molecular markers, performance status, and comorbidities. This assessment should then be cross-referenced with current, reputable clinical guidelines, e.g., NICE, RCR guidelines. Consideration of patient preferences and shared decision-making is crucial. If there are deviations from standard guidelines, these must be justified by robust clinical reasoning, and where appropriate, documented multidisciplinary team input. Continuous professional development and awareness of emerging evidence are essential to maintaining best practice. Question 19. Benchmark analysis indicates that patient preferences regarding chemotherapy intensity can vary significantly, even when clinical guidelines suggest a particular regimen. A patient with advanced lung cancer, who has previously experienced severe side effects from treatment, expresses a strong desire to avoid aggressive chemotherapy, preferring a less intensive approach focused on symptom control, despite the potential for a modest increase in survival with a more aggressive regimen. As the clinical oncologist, how should you proceed to ensure best practice and adherence to UK regulatory and ethical standards? Option A. Defer to the patient's wishes for symptom control without a comprehensive discussion of the potential survival benefit of the more aggressive regimen, assuming their past negative experiences fully dictate their current decision. Option B. Proceed with the recommended aggressive chemotherapy regimen, explaining that it offers the best chance of survival and that their concerns about side effects, while noted, are secondary to achieving optimal oncological outcomes. Option C. Engage in a detailed, shared decision-making process with the patient, thoroughly exploring their values, understanding of risks and benefits, and collaboratively agreeing on a treatment plan that respects their autonomy while considering clinical recommendations. Option D. Recommend a trial of the aggressive chemotherapy regimen, with a predefined stop date if significant toxicity occurs, without fully exploring the patient's underlying fears and preferences beyond their stated desire to avoid it. The correct answer is C. Engage in a detailed, shared decision-making process with the patient, thoroughly exploring their values, understanding of risks and benefits, and collaboratively agreeing on a treatment plan that respects their autonomy while considering clinical recommendations. Explanation. Scenario analysis. This scenario presents a common challenge in clinical oncology where a patient's wishes regarding treatment intensity conflict with the perceived optimal clinical pathway. The challenge lies in balancing patient autonomy with the clinician's duty of care, ensuring informed consent, and navigating the complexities of treatment toxicity versus potential benefit, all within the framework of UK regulatory and professional guidelines. The pressure to adhere to established protocols while respecting individual patient values requires careful communication and shared decision-making. Correct approach analysis. The correct approach prioritizes shared decision-making, respecting patient autonomy and ensuring informed consent. This aligns with the General Medical Council, GMC, guidance on decision-making and consent, which mandates that doctors must involve patients in decisions about their care and treatment. It requires a thorough discussion of the risks, benefits, and alternatives to chemotherapy, including the potential for palliative care or watchful waiting. The clinician must ensure the patient understands the information provided and is making a voluntary decision without coercion. This approach upholds the ethical principles of beneficence, non-maleficence, and respect for autonomy, ensuring the patient's values and preferences are central to the treatment plan. Incorrect approach is analysis. An approach that unilaterally imposes a treatment plan without adequate patient involvement fails to uphold the principle of patient autonomy and informed consent, contravening GMC guidance. This can lead to a breakdown in the doctor-patient relationship and potentially result in a patient receiving treatment they do not fully understand or desire, leading to distress and non-adherence. An approach that dismisses the patient's concerns about toxicity without a thorough exploration of their values and understanding of the risks is ethically problematic. Risks paternalism and fails to acknowledge the patient's right to make decisions about their own body and quality of life, even if those decisions differ from the clinician's preferred course of action. This neglects the GMC's emphasis on understanding and respecting a patient's values, an approach that focuses solely on achieving a specific clinical outcome without adequately addressing the patient's concerns about the impact of treatment on their quality of life is also flawed. While oncological outcomes are important, the patient's experience of treatment and their overall well-being are paramount. This approach risks overlooking the holistic needs of the patient and may lead to a treatment plan that causes significant suffering without a commensurate benefit in the patient's view. Professional reasoning. Professionals should adopt a structured approach to shared decision-making. This involves 1. Establishing rapport and understanding the patient's perspective, values, and goals. 2. Clearly explaining the diagnosis, prognosis, and all available treatment options, including the rationale for each. 3. Discussing the potential benefits, risks, and side effects of each option in a way that is understandable to the patient. 4. Eliciting the patient's preferences and concerns. 5. Collaboratively agreeing on a treatment plan that aligns with the patient's values and clinical best practice. If a significant divergence exists, further discussion, second opinions, or involvement of palliative care specialists may be warranted. Question 20. The monitoring system demonstrates that a significant proportion of patients receiving fluoropyrimidine chemotherapy are not having their DPID genotype status assessed prior to treatment initiation, despite emerging evidence suggesting its impact on drug toxicity. In this context, which of the following represents the most appropriate clinical action to ensure patient safety and optimize treatment efficacy within the current UK regulatory and professional framework? Option A. Defer DPID genotyping until further research definitively proves its universal benefit across all patient populations and fluoropyrimidine regimens. Option B. Continue current practice, advising clinicians to consider DPID status on a case-by-case basis if significant toxicity is suspected post-treatment. Option C. Prioritize DPID genotyping only for patients with a history of severe adverse drug reactions to similar chemotherapies, irrespective of fluoropyrimidine use. Option D. Implement a mandatory DPID genotyping protocol for all patients commencing fluoropyrimidine chemotherapy, with treatment adjustments guided by established genotype-phenotype correlations and current NICE guidance. The correct answer is D. Implement a mandatory DPID genotyping protocol for all patients commencing fluoropyrimidine chemotherapy, with treatment adjustments guided by established genotype-phenotype correlations and current NICE guidance. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the integration of pharmacogenomic data into routine clinical oncology practice. The challenge lies in translating complex genetic information into actionable treatment decisions while adhering to evolving clinical guidelines and ensuring patient safety and equitable care. Clinicians must navigate the uncertainty surrounding the clinical utility of certain pharmacogenomic markers, the availability of validated testing, and the potential for genetic information to influence treatment choices in ways that may not be fully supported by robust evidence. Furthermore, ethical considerations regarding informed consent for genetic testing, data privacy, and the potential for genetic discrimination add layers of complexity. Correct approach analysis. The correct approach involves a systematic and evidence-based integration of pharmacogenomic data into treatment planning. This entails consulting up-to-date clinical guidelines from reputable bodies such as the National Institute for Health and Care Excellence, NICE, or professional oncology societies, which provide recommendations on the use of specific pharmacogenomic markers in cancer therapy. It requires a thorough understanding of the genetic variants being tested, their known impact on drug metabolism or efficacy, and the strength of evidence supporting their clinical application. This approach prioritizes patient safety by ensuring that treatment decisions are informed by the best available evidence, minimizing the risk of adverse drug reactions or suboptimal treatment outcomes. It also upholds ethical principles by ensuring that any pharmacogenomic testing is conducted with appropriate patient consent, and that the information is used responsibly to guide personalized care. Incorrect approaches analysis. One incorrect approach involves disregarding pharmacogenomic data entirely due to a lack of familiarity or perceived complexity. This failure to engage with emerging evidence contravenes the professional obligation to stay abreast of advancements in cancer treatment and to offer patients the most effective and personalized care possible, as outlined in professional standards and GMC guidance on good medical practice. Another incorrect approach is to blindly adopt pharmacogenomic testing for all patients without considering the specific drug, cancer type, and the established clinical utility of the genetic marker. This can lead to unnecessary testing, increased healthcare costs, and potential misinterpretation of results, failing to adhere to principles of evidence-based medicine, and potentially violating the duty to provide appropriate and cost-effective care. A third incorrect approach is to use pharmacogenomic data in isolation, without considering other crucial clinical factors such as patient comorbidities, performance status, and disease stage. This reductionist view of treatment planning ignores the holistic nature of patient care and can lead to suboptimal or even harmful treatment decisions, failing to meet the comprehensive care standards expected of clinical oncologists. Professional reasoning. Professionals should adopt a framework that prioritizes evidence-based decision-making, continuous learning, and ethical practice. This involves actively seeking out and critically appraising pharmacogenomic research and guidelines. When considering pharmacogenomic testing, a structured approach should be employed. 1. Identify the specific drug and cancer type for which pharmacogenomic information might be relevant. 2. Consult current, evidence-based clinical guidelines, e.g., NICE, professional society recommendations, to determine if specific pharmacogenomic markers have established clinical utility for that context. 3. Assess the availability and reliability of validated pharmacogenomic testing. 4. Discuss the potential benefits, risks, and limitations of pharmacogenomic testing with the patient, ensuring informed consent. 5. Integrate pharmacogenomic findings with other relevant clinical data to inform treatment decisions. 6. Maintain ongoing education to stay current with the rapidly evolving field of pharmacogenomics.